Bryan Health takes the responsibility to lead and to do the things that make everyone better, healthier, and moving forward together. Here's another of our Bryan Health Radio podcast interviews with Melanie Cole.
Have you ever had the feeling that you're spinning or that everything around you is spinning? You may have benign positional vertigo, and that can affect many aspects of your quality of life. My guest today is Laura Corbridge. She's a Bryan physical therapist. Welcome to the show, Laura. So please talk about the difference between vertigo or benign positional vertigo and simple dizziness that some people get sometimes.
Right. The word dizziness is really an umbrella form, and so a lot of people refer to dizziness as many different things. Dizziness can be of true vertigo, which is a spinning sensation. This often feels like you're spinning or the environment spinning. Or you may have somebody say they feel dizzy when they actually are having some blood pressure issues and it's more of a lightheaded sensation. Or the other common cause of dizziness is when people feel more of an imbalance. So that has to do with more of their balance systems not giving them the right information. And so our job is to really figure out when someone says dizzy, what kind of dizziness they're talking about, and that will help us lead them to be able to have the appropriate treatment.
So people get this, they start getting it more often. What are some of the triggers? What are some things that you can identify or help people to identify that might set off this type of situation?
Right. BPPV, or benign proximal positional vertigo, is that feeling of that sensation of spinning. So, and it's primarily when you change positions. So when people get up and down from bed, or if they roll over to their side, or they're bending forward to tie their shoes, or they have to tip their head back, those are really common positions for people to have that spinning sensation. And that's different than the other dizziness sensations like I talked about earlier. There's really no rhyme or reason why some people have this. It's estimated there's 107 new cases per 1 million people each year, and it's more common for people over the age of 50 and with your female. Some of the causes behind this is really some people just wake up and they'll say, when I woke up, I sat up and I felt this intense spinning sensation, and they have no really reason why that happened. Sometimes it's more common if you've had a fall. Sometimes if somebody's had a fall, you can have that spinning sensation because of that mechanical problem in that inner ear, which is where this stems from. If somebody has a history of an inner ear infection or other vestibular-based disorders, you are more likely to get this BPPV. And it's also been associated with people who've had a history of migraines or motion sensitivity or even osteoporosis or diabetes.
Does it run in families sometimes?
I have heard a very strong genetic disposition. So some people say, after I get talking to them, they'll say, my aunt had this, or my mom or grandma always had this problem. So there is a genetic composition to it as well.
So if somebody complains about this, and you are a vestibular physical therapist, yes?
Yes, I've had advanced training to be able to perform vestibular-based tests and to be able to do treatment for these vestibular disorders. So the first thing is really to find out what kind of dizziness they're having, and if after my assessment, it seems like it's more of this benign positional vertigo, then we'll look at some treatment techniques.
So let's speak about some of the treatment techniques, Laura, because people don't know if there's something that can be done. They've heard about medications for this, but first speak from the physical therapist point of view, what you would do with somebody.
Right. Well, the first thing is to find out where exactly that little crystal, because it's a little piece of otoconia that gets dislodged. And it's in a space that it should not be in. And so we have 3 canals in our inner ear that help sense movement. And these canals have fluid in them, and they kind of tell the nerve cells where your head is in space. And they are not gravity dependent. So what happens when this little crystal piece becomes loose from a structure within the ear that it's supposed to be, and every once in a while that will break off. And like I said, there's really no rhyme or reason at times this happens. It gets dislodged in one of those canals. And what happens is that free-floating crystal stimulates those hair cells and that fluid movement, which then tells your brain that you're moving when you're not really moving. So the biggest thing is to find out where that crystal's at, because then all it is a mechanical problem that we have to move that crystal from that area to another area that doesn't cause problems. So the biggest thing is finding out which canal is involved. And so a lot of times we'll do a further assessment with positional testing, having people do positions to stimulate those canals. And then what's really, really neat is that we can actually look at how their eyes move, and we can tell by the position we're in and how the eyes move what canal is involved, and that will help guide our treatment.
Are there some things that people can do at home to work on this as well?
Right. There's a lot of information out there that there are a lot of treatment techniques, and there is one canal that's the most common, and that's called the posterior canal, and that's the most common where people get this little crystal stuck. So there are a lot of treatment techniques out there. There's something called the modified Epley. There's something called the half somersault. There's a lot of things out there. The problem is that sometimes you don't know what canal's involved. And if you don't do those right or know the canal that's involved, it's not going to make a difference, and you're not going to be able to clear that crystal out completely. So a lot of times when this is a new sensation, it's a very scary sensation. People feel like they're falling. People feel like they're really out of control, that you might need an actual professional to help guide you on what treatment technique is going to work best for you. And then my biggest goal is to teach somebody to be able to manage this, because unfortunately, if you have BPPV once, you're more likely to have increased incidence of having it in the future. But the biggest thing is teaching somebody how to be able to control this. So if that happens again, they wake up with that spinning, they have the knowledge base to know exactly how to treat this, so they don't have to keep coming back to a physical therapist or to the ENTs or the audiologist to perform these techniques.
So tell us a little bit about the balance and fall evaluations that you do at Bryan Health.
There's a lot of things that we can look at somebody for balance, and vestibular physical therapy is one big part of that. So screening people about a history of BPPV, other vestibular type orders, because some of these disorders have been undiagnosed or untreated, and that can lead to people having those balance and fall deficits. There are actually people who have BPPV that are not diagnosed for many, many years, and they've learned to change or avoid those positions that tend to exacerbate the problem, but they might have falls related to that problem. So really being able to look at somebody's whole entire system, their vestibular system, as well as looking at their strength and flexibility and other balance testing to figure out exactly where they're having those deficits at. We have specialized treatment techniques, and we as well as evaluative techniques. We have videos that we can, video lenses that we can put on people's eyes, so we can see exactly how their eyes move when we put them in positions when we're testing for that BPPV. We also have a NeuroCalm Balance Master, which is very unique, and it tells us exactly what systems they're using for their balance, whether they're using their vision, or they're using their vestibular system, or they're using their joints, their somatosensory system effectively, and that helps guide our treatment plan. And after we're able to do that, we're able to really individualize the program for somebody, because balance has a lot of different meanings for different people.
Well, it certainly does, in that proprioceptive learning curve that people go through when they're working with you is really something that can help them with all the different aspects of their life, Laura, not just if they have or suffer from vertigo. Are there some prevention techniques that you would like to tell us about? Anything that they can do to prevent the actual vertigo from occurring if they know that they have it, or to work on balance and falls?
Well, if somebody has a history of vertigo, that BPPV, if they know one side that's typically affected, we, talk to them about not lying on that side for prolonged periods of time. Avoiding that positions where they have to kind of have those pillows where their head is tipped back more. That can predispose them to having recurrence, and basically having that conversation about what they're doing in their normal life that may be triggering those recurrences, as well as for other balance things, keeping active, keeping in good exercise programs, keeping your flexibility, and looking at other community-based programs such as yoga and Tai Chi and all of those programs. And if you're still having issues, to really contact a physical therapist to really do that individualized plan of care.
Thank you so much, Laura, for being with us today. It's really great information. If you'd like to learn more about balance and fall evaluations at Bryan, you can go to bryanhealth.org/balance. That's bryanhealth.org/balance. Or you can call 402-481-9445. This is Melanie Cole. You're listening to Bryan Health Radio. Thanks so much for listening.